Did you know that choosing the right treatment for metastatic breast cancer isn't just about one decision, but a series of decisions? Each step can feel overwhelming, but with the right information, you can confidently move forward. If you or a loved one is facing metastatic breast cancer, it's important to understand the full range of therapies. Whether it's hormone treatments, targeted drugs, chemotherapy, or even surgery, your choices matter. Knowing your options empowers you to take control and find the path that works best for you. Hormonal therapies. Slowing cancer's fuel supply. For those with advanced hormone receptor-positive breast cancer, hormonal therapy is often the first line of defense. Here's the key. These therapies work by cutting off the cancer's fuel, hormones like estrogen or progesterone that help it grow. If your cancer is driven by these hormones, drugs like aromatase inhibitors, anastrozole, letrozole, or exemestane, combined with CDK4/6 inhibitors can help slow things down. But here's something that might surprise you. If you're premenopausal, your ovaries will need to be turned off, with treatments like Zoladex or Lupron for these therapies to work. Why? Aromatase inhibitors can only be effective when your ovaries aren't producing estrogen. It's all about chemistry. Side effects you should know. While these therapies can be powerful, they do come with side effects. Hot flashes, joint pain, and mood swings are common. Tamoxifen might even increase your risk of blood clots, while aromatase inhibitors can lead to bone loss. The CDK4/6 inhibitors, they can lower white blood cell counts, making you more vulnerable to infections. Understanding these effects can help you prepare, manage, and communicate with your healthcare team. Targeted therapies. Going after HER2 positive cancer. If your cancer tests positive for HER2, you've got a different set of weapons. Targeted therapies like trastuzumab, Herceptin, or pertuzumab, Perjeta, are designed to zero in on the HER2 protein, which fuels the growth of this cancer type. Think of it as a heat-seeking missile. These drugs don't just blast away at everything, they're focused on the real threat. But not every battle is the same. Some of these therapies, like Kadcyla and Enhertu, are stronger when paired with chemotherapy. It's not a one-size-fits-all solution, it's about matching the right treatment to the right situation. If one therapy stops working, your oncologist might switch you to a new one. Keep in mind, some targeted therapies are available as pills, which can make treatment easier for those looking to avoid constant trips to the clinic. What happens when hormonal and targeted therapies stop working? So, what happens when your cancer progresses despite these treatments? This is where chemotherapy often comes into play. But here's a crucial distinction. Chemotherapy is a more aggressive, systemic approach. It's designed to destroy fast-growing cells, both cancerous and healthy. Chemotherapy's tough trade-offs. Chemotherapy can work wonders, but the side effects can hit hard. Hair loss, fatigue, and nausea are just the beginning. And because it targets fast-growing cells, chemotherapy can also harm your bone marrow, mouth lining, and nerve cells. The result? You might experience numbness, tingling, or even changes to your fingernails and toenails. But remember, your oncologist has tools, like anti-nausea meds or immune boosters, to help manage these side effects. Triple-negative breast cancer. A different challenge. When breast cancer tests negative for estrogen, progesterone, and HER2, it's called triple-negative breast cancer. This type doesn't respond to hormonal or targeted therapies, leaving chemotherapy as the main treatment option. It's a tougher fight, but not without options. Each chemotherapy session is a step toward attacking the cancer where it hurts most. Radiation therapy. Targeting specific areas. Radiation is another tool in the arsenal, but it's used more sparingly in metastatic cases. The goal? To target and shrink tumors in specific areas, like the spine, brain, or bones, that are causing pain or other issues. Radiation won't cure metastatic cancer, but it can bring relief from symptoms like pain or pressure on the spinal cord. A key thing to remember: radiation can't be repeated in the same spot where it's already been used. That's why doctors often reserve it for cases where it's absolutely necessary, such as when tumors are causing serious symptoms like spinal cord compression. Surgery. When other methods don't relieve symptoms. In advanced breast cancer cases, surgery is generally less common but can still be an option when other treatments fail to control symptoms. For example, surgery may help relieve pressure caused by a tumor pressing on your spine. It's all about improving quality of life, reducing pain and keeping the body functioning as best as possible. Palliative care. Managing pain and symptoms. As cancer spreads to different parts of the body, pain management becomes critical. Pain levels vary depending on where the cancer is and how large the tumors have become. Your oncologist can refer you to a palliative care specialist who will help manage pain, nausea, and other symptoms like insomnia or neuropathy, numbness and tingling. Think of palliative care as a way to maintain your quality of life. It's not about curing the cancer, but making sure you're comfortable, physically, emotionally, and mentally. It's about giving you the strength to focus on the moments that matter most. Complementary therapies. Extra tools for relief. You might be wondering about other ways to relieve symptoms. Complementary therapies like massage, meditation, physical therapy, and acupuncture can provide additional comfort. These therapies won't replace medical treatment, but they can help you manage side effects and stress. Just make sure to discuss these options with your oncologist to ensure they're safe and effective for your situation. Stage 4 breast cancer. The long journey. Stage 4 breast cancer is a marathon, not a sprint. The cancer has spread beyond the breast and nearby lymph nodes, usually to the bones, liver, and lungs. At this stage, treatment goals shift. It's less about curing the cancer and more about slowing its spread, shrinking tumors, and giving you the best quality of life possible. You might continue with a combination of chemotherapy, hormone therapy, and targeted drugs for as long as they work and the side effects remain manageable. If things get too tough, there are always other treatments or clinical trials to explore. Clinical trials, in particular, can offer cutting-edge options that aren't yet widely available. The power of personal decisions. Remember, each treatment option comes with its own set of pros and cons. It's essential to discuss them openly with your doctor, thinking carefully about how they fit into your lifestyle, treatment goals, and personal comfort. You're the only one who can define your quality of life, so trust yourself in these decisions. Even if you decide to stop treatment for the cancer itself, you can still get help managing pain and symptoms. Your well-being is always the top priority. Conclusion. Knowledge is power. Navigating metastatic breast cancer treatments can feel like a winding road, but understanding the therapies available to you puts the power back in your hands. Every step, every choice, can make a difference, not just in the length of your life but in its quality. Stay informed, keep asking questions, and work closely with your medical team. You deserve a plan that's as unique as you are, and the right treatment can help you live fully, no matter what the future holds.